All right, everybody, I am doing tick removal. My topic was foreign body removal with dermatology. I thought this would be a really good area to touch on. I feel like it's pretty common, especially with how outdoorsy Colorado individuals are. And there's a specific way to do it, so let's get into it. Warning, there are some pictures of ticks. I apologize if it squeams anybody out. All right, let's dive into it. I wanted to give a little bit of background information before we got to the videos. We have about 30 different types of ticks. The most common in Colorado is Rocky Mountain wood and dog ticks. We are currently in peak season, which is spring to early summer. It's important to remember that they are active throughout the year, and elevation is not a safeguard. Altitude does not affect them. Can be found in elevations up to 10,000 feet. Adults can live up to about 600 days without feeding, which I thought was wild, and that's kind of just a fun fact. They do put themselves on the tops of plants or blades so they can easily attach to passing people or animals. The parasites are highly sensitive to their surroundings and can detect body heat, carbon dioxide, body odor, vibrations, allowing them to identify potential hosts. The picture here is the Rocky Mountain wood tick, and they have a hard shell. They're large, they're usually reddish brown, and they're very ornate. I wanted to give a little bit of background on the Rocky Mountain spotted fever disease. It is very rare, but it does come from the Rocky Mountain wood tick, which is one of the most common ticks here found in Colorado. Despite the disease being rare, we should be vigilant of the disease because it can progress rapidly and become life-threatening if not treated properly. This has been a nationally reportable disease since 1920, and it is caused by the bacterium Rickettsia rickettsii. This gram-negative organism is an intracellular bacterium that infects the endothelial cells lining the blood vessels, leading to widespread inflammation and potentially severe complications if left untreated. The incubation period ranges anywhere between 2 to 12 days after the tick bite, and most clinical cases, most symptoms occur between 5 and 7 days after exposure. Early symptoms can be very nonspecific. They can include fevers, headaches, malaise, nausea, muscle aches, and this can really make diagnosing challenging. There is a rash that can typically be associated with this disease. It can develop within 2 to 4 days after the onset of the fever. It usually begins as small, flat, pink spots on the wrists, forearms, ankles before spreading towards the trunk. In some cases, the rash may involve palms and soles of the feet. As the disease progresses, the rash can become petechial, appearing as small red or purple dots caused by bleeding under the skin. This petechial rash generally develops around day 6 or later and may indicate a more advanced disease. It's important to note that not all patients will develop a rash. They may not develop it at all, or they may not develop it early on in the disease. Because of the variability of Rocky Mountain spotted fever, it can be difficult to recognize, so we really need to highlight the importance of obtaining a thorough history of the tick exposure. And the diagnosis of this is initially made based on consistent clinical signs and symptoms in the appropriate setting, as well as the therapy should be initiated promptly once the diagnosis is suspected, because delayed treatment can be associated with increased mortality. And also really important to know that most clinical laboratories don't have the ability to culture for this spectrum. So the clinical diagnosis can be confirmed with serology testing and use of PCR testing, but that will take a while to get back. Our treatment for this will be doxycycline. I wanted to touch base on Lyme's disease just real quick, because I know you're all thinking about it. So apparently Lyme's disease is mostly found in the northeastern region, mid-Atlantic, and upper Midwest region of the country. About 95% of cases come from those regions. You can see on the map on the top right there, the blue areas is where Lyme's disease has been reported. Lyme's disease does come from the black-legged tick, and it develops the hallmark sign of the bullseye rash. There's only been a handful of cases of Lyme disease reported in Colorado, and none of the exposures originated in the state of Colorado. Just something to keep in mind. All right, on to methods. Don't forget to get consent. This is a procedure. We do want to get this tick out promptly with proper technique always. There are some contraindications of any tick removal near the eye or artery that can be dangerous. I refer them to specialists for that. For prompt removal, it's really important because a lot of the diseases are transmitted between anywhere from 24 to 48 hours of vector exposure. So it's very important that we remove these as soon as possible. You do not want to use your fingers when pulling these guys out. You make sure you're wearing gloves, and then do not twist, crush, tear anything near the tick. There's a specific technique to do it. You do not want to leave any of the remaining parts of the tick in the patient's skin. This will lead to further contamination if we don't get all the parts out. You want to avoid using alcohol, nail polish, and or burning the skin. It is not an appropriate intervention to remove the tick. It can cause more harm than good. There are 3 methods that our book talks about. Method 1 is forceps and tweezers technique. Method 2 is the thread technique. And then method 3 was the punch biopsies. I decided not to go over the punch biopsies since we just did those at the OSCEs. For the prep, it's going to be the same exact thing for method 1 and method 2. You're going to want your skin cleanser. You can use iodine or alcohol. Iodine is better for open wounds. It has less damage to the skin and then less stinging. You want to use gloves. They don't have to be sterile. You want to have 1% lidocaine on hand with a 3 ml syringe. You want a subcutaneous needle at bedside. We don't need a magnifying glass. You want some blunt curved forceps or tweezers. These should be sterile, on top of 4x4 gauze, which are also sterile, some band-aids, some saline, and then some sutures that should be nylon. 4 to 5 size-wise would be good for this. Hey everybody, time to learn how to take out some ticks with our lovely Nexplanon arm. First, you're going to wash your hands. Second, you're going to get gloves, don on your gloves. I could only find one, so that's my one glove. I would have 2 on. We're going to want to clean the area first. In my previous slide, if there's an open wound, iodine would be best. You can also use alcohol. I'm just going to do the alcohol for now so I don't stain anything. I'm going to want to make sure that the site is nice and clean. Couldn't find any needles or syringes, so I had an insulin syringe. We're going to use that. I just filled it up with some saline, but you're going to want to do some 1% lidocaine, and you more than likely won't need any epi in it because this is pretty superficial. But you want to make sure you have your bevel up. It's kind of hard to see on this guy. There's an air bubble in there, but we're going to ignore that. You're going to want to go below the tick, and you're going to want to go at a 45-degree angle. We're just trying to get like a wheel underneath the tick at this point. And you're going to want to insert at like a 45-degree angle, draw back, make sure you're not in any sort of vessels. Go ahead and give that a wheel. It's not going to really show us here, but we're going to nice and pretend. I'm going to save that for maybe a next video. Other than that, I would lock it normally. From here, you're going to probably just wait a few minutes. It'll get nice and numb for the patient. The first method we're going to use is just tweezers. You can do hemostats as well. These might be a little bit harder to control because you really don't want to squeeze or twist, crush the tick at all. It could cause a lot more complications, so tweezers would probably be best. From there, you're going to want to grab the tick as close to the skin as possible. For my demonstration, I'm using little cloves, so the heads there are just pretend to be the heads of the tick. And you're just going to want to grab as close to possible to the skin. You're going to pull directly up at a 90-degree angle, and you're going to go a really soft pull, if that makes any sense. You don't want to rip it out, because if there's any parts of the tick that are left in the skin, it can still cause disease and infection. So you really want to make sure you get all of that out. And sometimes the ticks just kind of hold on to the host. So what you want to do is just have like gentle pressure upwards and then just kind of hold it there for about 2 to 4 minutes. And eventually the tick should let go. And then there you go. You're going to want to put the tick in a separate container so there's no reinfestation to the host at all. Make sure you get rid of that properly. You're going to want to clean the wound now with some CHG. You can rinse it off with some normal saline and then top it all off with a nice little Band-Aid. If it's bleeding, you can also use some Coban to wrap it around and put a little bit of pressure on it. Method number 2, we're doing the sutures. The entire first couple of steps are going to be the same. Wash your hands, don on both gloves. I unfortunately only have one glove. You're going to want to clean the area again with alcohol or iodine. You're going to want to inject with lidocaine below the tick, make a wheal, just like I did in the last video. From here, you're going to want to get your suture. Obviously, you would not stick it in the arm like I have here. You're going to want to just do a simple loop, just one little loop. It's kind of hard to see. I wish it wasn't blue. Influencer hand here. And then you're going to want to put the loop just around the tick. Again, same exact idea. You want the loop to go as close to the skin as possible. That's where the head of the tick is. And you're going to want to just wrap it around there. Pull gentle pressure upwards for another 2 to 3 minutes. Same thing. You don't want to rip it out or anything, and just wait for the tick to let go of the host, and it should pop right back out. From there, again, tweezers, you're going to want to put this in a container so we don't reinfect anybody. You're going to want to clean it, rinse it, Band-Aid it. Done. After all the fun has occurred, we need to think about some aftercare. You do want to keep the wound clean and dry. After about 24 hours, the dressing can be removed and the site can be left open to air, and letting the patient know that keeping it covered can increase the risk of infection. You want to cleanse the area with warm water, blot dry with a clean towel, and then you want to educate the patient on any signs of infections as well. Elevated temperature, fever, yellow to green drainage, redness or swelling, foul odors, increase in pain after 24 hours. If there's any of these signs or symptoms, they need to return to the office. They also recommend that you get a Tdap booster vaccination if you have not already had one in the last 5 years. Prevention is always going to be key over treatment any day. You really want to use a combination of chemical and physical prevention in order to lower your risk of getting a tick-borne disease. You can do natural repellents such as citronella. You can use DEET. 10% of DEET is going to give you 2 hours of protection. 20% of DEET is going to give you about 4 to 5 hours. 30% DEET is about 6 to 8 hours. Anything higher of 30% of DEET does not show any significant longer period of protection. Just for your information. Physical, you do want to wear lighter colored clothing just for the fact that you can see the ticks better before they actually embed into your skin. Tight-fitting clothing around your wrists, neck and ankles are going to be important as well. You can tuck your pant legs into your socks. You can wear high socks as well. That will all help. Make sure you're wearing closed-toed shoes. You want to inspect for any ticks when you get home, especially on your dogs. If you have any pets, they can bring that into the house. You're going to want to inspect in the shower, all the crevices of your body, your tents, your sleeping bags. All of that is going to be key. You can avoid direct contact with mammals that are in high populations of ticks, such as deer and rodent. You want to avoid wooded areas, such as camping and hunting. That's not realistic here in Colorado, but just a way of prevention. Just don't do it at all. Thank you everybody for listening. That was my presentation. I hope you enjoyed it as much as I did, and here are my references.